Hey folks, it's Dr. Sam, and I received a great question today from Johanna. She's got a child who's been diagnosed with crossed eyes, and she's contemplating eye muscle surgery, but she also wants to know about my approach. So this condition is called esotropia, and it's a misalignment in the eyes. They're not working together, and either the person can see double, or the brain suppresses or shuts off one of the eyes to avoid the double. So some of the causes include poor fetal movement in gestation, challenges with birth, even things like forceps delivery or C-section, any kind of birth trauma, and even problems in early motor development. If a child doesn't go through the crawling stages properly, this can have an inhibition in visual coordination. Obviously things like head trauma, illness, these are also other causative factors as well. So the two main treatment modalities are surgery and vision therapy. So when you do surgery, what the surgeon does is he's cutting one of the muscles, and so this straightens the eyes momentarily, but it creates a permanent confusion in the brain, because unless you tell the brain what you're doing to the eyes, most likely the eye is going to revert back to the esotropia. In fact, the success rate of strabismus surgery is very low. And if there is a problem with the surgery, many times the surgeon will do the strabismus surgery 2 and 3 times. So it's not something that I recommend. I don't think it's an effective surgery. I think that vision therapy is a much better approach. So what is vision therapy? Vision therapy is a form of physical eye therapy, and the exercises are designed to help a person communicate the brain to the eyes in a more effective way. Now, we really see through the brain. It's the brain that directs the eye muscles. And so vision therapy offers an approach where a person has a re-education or relearning of getting the two eyes to work together. Now in children, it's important that you include the body in the equation of vision therapy. That's why we do a lot of activities where we say we're doing gross motor, bilateral integration, visually guided and directed movements through obstacle courses, even things like craniosacral therapy can be very effective, something that I use, color therapy. So there's a lot of different techniques to help encourage a person to learn how to use both eyes together, because it's a relationship between the brain and the eyes, and vision therapy offers an organic approach instead of using the surgery, which is treating more of a symptom. So I hope that's helpful. I want to thank you, Johanna, for the question, and I hope this information has been helpful. So that's my message for today. Thank you so much for tuning in. Take good care.